far as diagnosis, most commonly it's diagnosed on physical examination. During an annual visit, the gynecologist may tell a woman that they can feel that the woman has uterine fibroids. And then the first exam that's generally performed to confirm that is a pelvic ultrasound, and that can be performed either with a probe on the woman's belly or using a vaginal probe. Some people will have a CAT scan for a completely different reason, say for example for pelvic pain, and the uterine fibroids will be seen on that CAT scan. MRI is an excellent tool being used for diagnosis, but a lot of times we use it once we already know a woman has uterine fibroids and we're trying to make treatment decisions. And then there's hysteroscopy, where a scope is put actually into the vagina and then through the middle part of the uterus to look at the uterine fibroids, or laparoscopy, where a scope is put in through small little incisions in the abdominal or pelvic wall to look at the fibroids from outside. As far as treatment go, most women, as I said earlier, are asymptomatic, and they don't need any treatment, and just basically surveillance either with follow-up pelvic ultrasounds or just physical examination is all that's needed. Sometimes patients will require treatment, and the first line of therapy is generally medical therapy, and that can include hormone-based therapy such as birth control pills. If women are having cramping or pain, sometimes non-steroidal anti-inflammatory medications such as ibuprofen. Some patients are anemic and therefore they need iron supplementation, and then a variety of other multivitamins and homeopathic medications have been used to treat minor symptoms. And in many patients, when symptoms are controlled with medical therapy, no other treatment is needed. Sometimes hormonal therapies will have side effects that women cannot tolerate, or there are other risks when being on certain hormonal medications long-term, so it's really, they're generally just used short-term. And a lot of times when hormonal therapy is discontinued, the fibroids that may shrink as a relationship to that hormonal therapy, they will grow back. So if women don't tolerate or don't have a successful outcome from medical therapy, then we talk about actual treatment options which are a little more invasive. So I'll run through a bunch of these. For women who are having heavy menstrual bleeding from their uterine fibroids, sometimes an endometrial ablation where the lining of the uterus, the inside lining of the uterus is cauterized, and that could be done with a standard electrocautery, but can also be done with certain devices, one called the NovaSure device and the other is a ThermoChoice balloon, and there are a variety of others also, but the whole idea of that is really to be used in women who are having heavy menstrual bleeding. The issue with that is certainly in women who have an interest in future pregnancies, really they can't get pregnant after that because it does destroy the lining of the uterus. There is also a technique called MR-guided high-intensity focused ultrasound, and generally that's where a patient is on an MRI machine and very high-intensity ultrasound energy can be penetrated through the abdominal or pelvic wall to ablate or destroy the fibroid. The issue with that is generally it can take many hours to just one fibroid, and it's not widely available, and there is no, currently there's been no insurance coverage for that procedure. Another option, and probably the most common options, are surgery, and that includes myomectomy, which again is removal of the individual fibroid or fibroids, or hysterectomy, and those surgeries are most commonly performed with an abdominal incision. However, they can be performed laparoscopically or hysteroscopically assisted as well. And then we're going to come to uterine fibroid embolization, which is the one that I'm going to talk about that's performed not by a gynecologist but actually an interventional radiologist.